topics and opinions expressed on the following show are solely those of the host and their guests, and not those of W4CS Radio, its employees, or affiliates. W4CS makes no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. Any questions or comments should be directed to those show hosts. Thank you for listening to the Cancer Support Network on W4CS.com. Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Everyone, and welcome to 5 to Thrive Live. I am Carolyn Gazella, the host of tonight's show, and tonight we're going to be talking about one of our 5 key pathways, and that is digestion, specifically intestinal health. But before I introduce you to our expert guest, who is calling in all the way from Australia, I want to remind you that I co-host this show with my good friend and co-author, Dr. Lise Alschuler. You can find out more information about us and our new book, The Definitive Guide to Thriving After Cancer, which is a revised and updated version of our 5 to Thrive. All that is at our website, 5tothriveplan.com. That's all spelled out, 5tothriveplan.com. You can also sign up to receive our free weekly Thrive Thoughts and our radio schedule. Just type in your email at the top of the website and you are good to go. I'd also like to take this opportunity to thank the sponsors of our show, who are Sun-Theanine, Sun-Phenin Green Tea, Tomorrow's Nutrition, Cetria Glutathione, and Cognizant Citicoline. We appreciate our sponsors very much. And finally, I'd like to remind you that we are live and we're taking your questions tonight. You can either call us at 561-623-9427 or just type your question into the chat room. We're going to be monitoring that chat room throughout the show. So the health of our digestive system is so significant. And if we're struggling with issues like gas or bloating or constipation or even irritable bowel syndrome, we are even more aware of the importance of this pathway. Our guest tonight is an expert on the effective treatment of small intestinal bowel overgrowth. We're going to learn more about that in a minute. Dr. Nirala Jacobi received her naturopathic doctorate from Bacterial University. She has a clinical practice in Brisbane, Australia, and is very involved in the naturopathic community there, where she mentors naturopathic students and new physicians. We are thrilled to have her join us on the show all the way from Australia. Welcome to the show, Dr. Jacobi.
Thank you, Carolyn. It's great to be joining your program today.
Yes, and I have to ask you, I forgot to look this up, about what time is it in Australia right now? It's morning, correct?
It's 10 o'clock in the morning, and I just came back from my organic farmer's market, so I'm all stocked up.
Oh, nice. Great. Well, good for you. Well, we're just thrilled, and I always like to, before we dig into our topic, I always like to get to know our doctors a little bit, especially the first time that they're on the show. So my question to you is, why did you want to become a naturopathic physician?
Well, this was about 20 years ago that I looked into naturopathic medicine, and I had a real passion for nutrition and initially entered Bachelor for a nutrition degree, and then quickly found that I was very much aligned with the core principles of naturopathic medicine, which is really about finding the underlying cause of a problem rather than just medicating symptoms, and also just about promoting health rather than just treating disease. So it really was very much aligned with me. And Dr. Alschuler was actually one of my professors at Bastille during the time I was there. So I know her very well, and it's nice to come full circle right now.
Absolutely. I know we've had some of Dr. Alschuler's other students, and we've actually had some of her mentors, which is kind of fun as well. Well, good. Well, tonight we're going to be talking about irritable bowel syndrome But a lot of people have never heard of this term that I use to introduce you, and that is small intestinal bowel overgrowth, or SIBO. Tell us what SIBO is, and why is it important that we know about this particular term?
Well, SIBO actually stands for small intestine bacterial overgrowth.
Okay.
And what it is it's basically where bacteria, which are normally found in the large intestine, are overgrowing in the small intestine. And it's very significant because the small intestine is an area where we have all of our absorption of nutrients and breakdown of food. And when you have an overgrowth in that area of pathogenic bacteria, but even also normal bacteria, you can really run into problems with malnutrition, malabsorption, and certainly all of the symptoms that we're very familiar with irritable bowel syndrome. And irritable bowel syndrome typically is what we call sort of a multifactorial illness. It has not just one cause, but very often we see that it's caused by a number of problems, and SIBO is actually one of the main causes of irritable bowel syndrome, and yet it is so often underdiagnosed. A lot of doctors don't know about it. It's really sort of one of the main causes that I've seen of digestive problems in my practice. So I've really focused on it quite extensively over the past 3 years and have developed programs to deal with these issues. And, it's when we look at irritable bowel syndrome, there's so many things like food sensitivities and lack of enzymes, digestive enzymes, or sometimes even lack of stomach acid, all of which can cause the very symptoms that we see with small intestine bacterial overgrowth. So sometimes it can be sort of confusing as to what, how to actually approach the condition, because the symptoms are so similar when you have all of these different causes.
Yeah, and it's interesting. I should have gotten that correct about the bacterial overgrowth, because Dr. Altshuler and I just co-authored a paper that's going to be coming out in the Natural Medicine Journal, a special issue on gastrointestinal health. And I'm curious, and we definitely talked about it, and it came up as a key contributing factor to IBS. But I'm wondering, how prevalent is IBS? How common is it?
Basically, in my practice, I would say it's probably the most common reason why people come into my practice. And I think it's, again, there's so many reasons why we have digestive disorders. Sometimes it's because of dietary factors, but a huge part of that is just the epidemic of stress, which can certainly set up the conditions in which SIBO can develop. And that has again a lot of different reasons, because a lot of your nervous system is actually in your digestive tract, and when we have a lot of stress, it certainly can affect the motility of the digestive tract. And when we're dealing with SIBO, it really is this really interesting condition where we have this bacterial overgrowth in a situation or in a location where it causes bloating, directly after meals. It can cause a lot of systemic symptoms such as restless leg syndrome, and it can cause just a number of conditions that we also associate with stress and other conditions. So it's such a prevalent condition, and most of the people that I test in my practice that I've usually tested for IBS, most of them test positive for SIBO. So in my practice, it's certainly a very prevalent condition.
Yes, and after the break, we're going to talk in more detail about these digestive issues, and specifically what happens with your digestive system after conventional cancer treatments. It's interesting that a lot of people underestimate the power of a healthy digestive system. So we're going to delve a little bit more deeply into that after we take this first quick break. So when we come back, we're going to continue our conversation with digestive health expert Dr. Nirala Jacobi. Stay tuned. We'll be right back. Welcome back to 5 to Thrive Live. If you've just joined us, my name is Carolyn Gazella, tonight's host, and my guest guest is Dr. Nirala Jacobi, who is joining us from Australia. I want to remind you again that we are taking your questions tonight, so you can call us at 561-623-9427 or just type your question into the chat room. It's located in the bottom right-hand corner of the website. Just click on it and you'll be able to type your question in anonymously. Now, before we dig into our topic, Dr. Jacobi, when we're talking about SIBO, who are some of the leading experts in the field of naturopathic medicine in this area, which is a really innovative, important area when it comes to digestive health? Who do we look to for expertise here?
So when I first learned about SIBO, it was at a conference about 3 years ago, and I had attended a lecture by my two colleagues, Dr. Alison Seebecker and Dr. Stephen Sandberg-Lewis, and they talked about SIBO, and it was really so shocking to me that as a naturopathic doctor, I had never really heard about this condition, and they did an excellent job with really going through the nitty-gritty of this condition. But they also referenced Dr. Pimentel, Dr. Mark Pimentel, who's the head of gastroenterology at Cedars-Sinai Hospital in LA, who wrote a book a few years ago called The New IBS Solution, in which he outlines how to diagnose and treat SIBO in a conventional manner, which is usually involving antibiotics and a certain diet and so forth. But because I was just so sort of flabbergasted that I'd never heard of this, I just set out and learned everything I could about this condition over the last 3 years. And Dr. Seebecker is actually in the process of writing a book about the natural treatment for SIBO, and Dr. Stephen Sandberg-Lewis teaches gastroenterology at one of the naturopathic universities in Oregon.
Okay, perfect. It's good that we have leaders in this area because it is so significant. And I'd like to, talk specifically about cancer treatments because a lot of our listeners have gone through conventional cancer treatments, or perhaps they have a loved one who has. So when it comes to chemotherapy and radiation, are digestive issues common in these folks? And if that is common, what's going on? How does chemotherapy and radiation affect our digestive system?
Yeah, that's a great question. So there's a number of things that happen. So if we look at chemotherapy, we know that the whole point to some of these chemotherapeutic agents is to target rapidly dividing cells. And that includes, unfortunately, we see some damage in healthy cells, and specifically the digestive tract is also targeted by some of these drugs. So we see some damage occur to the digestive tract, but luckily it's quite forgiving. So when you actually, after the chemo has finished, you can really do a lot to recuperate your health in your digestive tract with healthy eating habits and using certain nutrients like L-glutamine or probiotics that can really help to boost the health of the digestive tract. When it comes to radiation, especially sort of abdominal radiation or pelvic radiation, it can affect the motility of the digestive tract, and it can lead to slow transit time, and it can lead to the very conditions that are then perfect for bacterial overgrowth to occur in the small intestine.
Now, are people going through conventional cancer treatment, so even after they're done, are they more susceptible or at risk for conditions like IBS?
I certainly see that in my practice, that patients that have undergone conventional therapies tend to have a lot more digestive issues, and that may be due to a number of factors. Also, sometimes their immune system is a little bit lower because of various factors, but because 80%, something like 70 to 80% of your immune system is actually in your digestive tract, it can also mean that if that's lower, you are a little bit more susceptible to certain overgrowth like yeast, and which is pretty common, and other pathogens in the digestive tract.
Yes, I mean, that's what Dr. Alschuler and I hear a lot as well. People are reporting that, before the treatment, their digestive system was just running smoothly, and then they've gone through treatment and all of a sudden they're struggling and having issues. So the positive thing that you mentioned is that you can rebuild and boost, and you can reverse a lot of those issues, and that's what we're going to be talking about tonight. But let's talk a little bit about some of the more common symptoms and the concerns that you have associated with SIBO.
So the symptoms associated with SIBO are really the classic symptoms that we see with irritable bowel syndrome. Most people that have digestive complaints would, complain of bloating, gas and bloating, especially right after meals. We see a lot of constipation, a lot of alternating constipation, diarrhea. Some people have just diarrhea. There's a lot of that type of symptom picture that we see. That's what I meant before, where we just see exactly the same symptoms as IBS. So it's sometimes really difficult to differentiate between the two, and this is where when we talk about testing, it's really important that that's properly diagnosed, because the treatment, in my opinion and in my experience, is quite different. So, for example, when we have somebody that just has sort of run-of-the-mill irritable bowel syndrome, very often we would recommend fiber for that patient to increase bowel motions and transit time. But that's the exact opposite of what you would do for somebody that has small intestine bacterial overgrowth, because the fibrous foods are fermented by the bacteria, and we see a lot more fermentation with SIBO patients. So it would be the exact opposite advice, So, for example, with a SIBO patient, I take them off of most fibers. And so you have to really know if it's something like, just lack of hydrochloric acid or stomach acid, which is really important for the breakdown of your proteins. And that sometimes is the only problem. So when you then supplement with hydrochloric acid, people's symptoms disappear. And that's more of a sort of irritable bowel syndrome. But that wouldn't be the case with somebody that has SIBO, because they still have that bacterial overgrowth. But the other thing is, in terms of symptoms, you can see a lot of systemic symptoms, meaning that you can suffer from fibromyalgia, or you can suffer from a condition called interstitial cystitis, which is just painful bladder. You can have chronic fatigue. You can have aching all over. These are all symptoms that we see with SIBO, and not necessarily with irritable bowel syndrome, although, as I've mentioned, there's a lot of overlap there.
That's really interesting, because I wasn't aware that there was such a difference, like the fiber versus the not fiber with SIBO. I think that's such an interesting point. And before, I'd like to talk a little bit more specifically, but before I go into specific questions, is it possible to test for SIBO? And is it just the naturopathic physicians that are testing for SIBO, or does conventional medicine test for SIBO as well?
When Dr. Pimentel wrote his book, it was, I think, 5 years ago or so. And, as you probably know, that any time a doctor kind of sort of challenges the dominant paradigm, they are ostracized. And so that also sort of happened with him, where there was a lot of, opposition in conventional medicine that that's not the case. SIBO is not usually the cause for IBS. And he really did a lot of research, and I think it has gained a lot of acceptance by conventional medical doctors. So, yes, we do see doctors testing for SIBO a lot more frequently. Here in Australia, that's still struggling quite a bit, and so my whole focus is to raise the awareness, especially in the alternative medicine community, because the testing is so simple. It is done by breath testing, and I can talk about that a little bit later if you want, but it's not a difficult test to do.
Yeah, I would like to know more about that, because I remember when I was looking at the scientific literature, I saw that it was a breath test, but I was curious about accuracy and ease of that test.
Yeah. So basically, the whole background or premise of this test is that when we are testing for certain gases called hydrogen gas and methane gas, we are actually testing the direct product of bacterial fermentation. And that is because humans don't produce these gases. They don't produce methane and they don't produce hydrogen. So when we have a patient fast and then give them a sugary substance to drink, and then they collect their breath samples every 20 minutes, we can then determine if we see a spike in methane and hydrogen whether or not there is a bacterial overgrowth in the small intestine, because it's a timed test. So in other words, if you find the presence of these gases in a certain amount within the first 2 to 3 hours, you can pretty much deduce that it is the small intestine and not the large intestine, where we would expect to see a spike in these gases because we have a normal amount of bacteria there. So it's a pretty simple test. People can either, I do take-home tests for patients. They very conveniently do a preparation diet where all fiber is taken out for about 12 hours. Some people that are constipated have to do the diet a little bit, more like 2 days, and it's just, meat and a little bit of rice and some eggs. That's all you can eat for about 12 hours. Then you fast overnight, and then you do the test the next day, and you bring in your samples to the lab or to the clinic. And some doctors have machines in their offices, or they refer out for that. So it's not a difficult test to do.
And, the way that you described it, it makes sense. So it makes sense that it would, in fact, work. So I'd like to get back to symptoms and diagnosis, because I think that IBS and certainly SIBO can be very difficult to diagnose. And you mentioned some of the symptoms: bloating, gas, constipation, diarrhea, alternating constipation, diarrhea. But you mentioned a really good point about these systemic other physical symptoms that are showing up, that the fibromyalgia, the pain and the fatigue and some of these other things. So how difficult is it to diagnose? And this part 2 of that question is, if there's a listener right now who's listening, who's been told, you know what, it's all in your head, or it's just stress, thinking, well, gosh, I'm going to have to live with this. What advice do you have for that listener?
Well, first of all, I'm a naturopathic doctor, so I don't believe that you ever have to live with a condition like that. Because when we're talking about the digestive tract, that's really the root of the tree. And if that's not healthy, the rest of you has much less of a chance to be healthy. So that's why, any good naturopathic doctor will focus on the digestive health first and foremost. And just getting back to the SIBO a little bit, in terms of, or let's just say a patient comes to me and they have digestive symptoms, there are certain clues that it might be SIBO. So, for example, if somebody says, I had a case of, gastroenteritis or just sort of the stomach flu, and I never recovered from that. My symptoms started when I had that condition, when I just had food poisoning, or I had, I just had a stomach bug, and symptoms never resolved. That's a big clue that it might actually be that the small intestine has now overgrown with these bacteria. And that could be because the motility of your small intestine has been sort of affected, and that can definitely happen. Another clue might be that somebody says, my symptoms actually improve when I take antibiotics for something like sinusitis or for bronchitis, for something totally unrelated, but I notice that my irritable bowel syndrome symptoms disappear when I'm on antibiotics. That's a huge clue, because antibiotics would sometimes sort of temporarily clear up the bacteria in the gut, or significantly reduce their number, and people can improve with that. Unlike if the IBS is due to, like I said, either not enough enzymes or lack of stomach acid or yeast overgrowth, then those symptoms would actually not improve at all on antibiotics. So I often ask very specific questions. On my website, you can take a quiz. There are certain questions that you can take on there and just see if that's an issue. So I very specifically weed people out that I think would be good candidates for testing And sometimes I just do a trial of a diet, or I do a trial of a particular supplement. And if people really improve, then the likelihood of SIBO is not that great.
Okay, and can you remind us what your website is so people can go ahead and take that quiz? What is your website?
Well, the website that I developed, which is sort of a testing website, which is for Australian patients to order SIBO test kits, and that is sibotest.com. And you can also watch a 4-minute video about, sort of exactly what SIBO is. And there's also a quiz that you can take, and it just takes about a minute or two to do, and it gives you a score at the end as to whether SIBO is likely or unlikely. So it's a helpful tool.
Yeah, it sounds like it, and that's SIBOTEST.com, and we're going to go ahead and post that on Facebook as well, so people who may have not caught the show can also go there as well. So basically, Dr. Jacobi, you're kind of on a fact-finding mission when you're dealing with a patient to kind of figure out.
That's right.
Mm-hmm.
Yeah. Because sometimes, when people have, like, for example, here in Australia, and we have a certain area that's very endemic for certain parasites. So I still do sometimes stool testing to rule out if somebody has parasites. And that can certainly also be the case when somebody has irritable bowel syndrome symptoms. But really, if you are somebody that gets worse with fiber, has a condition or had a condition before, such as gastroenteritis, and things never really improved after that. And also another clue might be that certain probiotics that actually contain something called prebiotics, which is sort of like the food for the good bacteria, can also worsen symptoms of SIBO. So sometimes when we prescribe probiotics, which we all know are wonderful for the large intestine, might not be a good idea for the small intestine.
Wow, that's such a good point, because you're right. The prebiotic is like it's like fiber for the good bugs, right? Or food for the good bugs.
That's right.
That's such a good point. You know what? When we come back, we're going to take our final break. But when we come back, we're going to get Dr. Jacobi's advice about diet, lifestyle, and dietary supplements as it relates to IBS and SIBO, and we're going to kind of separate the two and figure out what's what. So we're going to take our final break, but when we come back, we're going to continue our conversation with digestive health expert Dr. Nirala Jacobi. Stay tuned. We'll be right back. Welcome back to 5 to Thrive Live. I'm Carolyn Gazella, tonight's host, and I am joined by Dr. Nirala Jacobi, who is from Australia, and we are talking about irritable bowel syndrome and SIBO, and that is small intestinal bacteria overgrowth. A fascinating topic, because the reality is your symptoms may not be IBS. They may be more SIBO. So it's very important to determine what's going on, and then it's important to make proactive steps to help heal your digestive system. And that's what we're going to talk about next, Dr. Jacobi. So from a dietary standpoint, what should people focus on if they've been diagnosed with IBS, and then how does that differ if they have SIBO?
So that's a great question, because the advice is often completely the opposite. But with irritable bowel syndrome, again, it sort of depends on what the cause is. Sometimes people have symptoms because they're eating foods that they're sensitive to, especially things like dairy or gluten. So in those patients, clearly removing those foods would improve their digestive tract. Sometimes people have just generally, because their digestive system is quite weak and they lack the digestive juices, and so these people need to be more supplemented with digestive enzymes, or they need more fiber in their diet, or those kinds of things. And so it comes down to, there really, in my opinion, isn't just a kind of general advice for IBS. There are certain things that universally, I would say, everyone can agree on, that a healthy whole food diet certainly is the best approach for digestive health, but also overall health. But how it differs from SIBO is that, let's say that you have SIBO, you have this bacterial overgrowth that now ferments all of the food that you're eating rather than actually you're digesting it. And so certain foods cause a lot more fermentation, and so we would remove those foods, and particularly things like dairy. So one example is somebody that doesn't have SIBO may ferment a couple of tablespoons of milk into, maybe 50 milliliters of gas, versus somebody that has SIBO that can ferment that same amount of milk into something like a gallon of gas. So it's really a big difference. So we remove those foods that are very fermentable. That includes legumes, which is lentils and beans. It includes all grains, and it includes sugars and certain alcohols and things like that, and fruit as well. A large number of people that have very severe SIBO actually are fructose intolerant. And so the good dietary advice of eat more fruit and so forth may actually not be the right advice for these patients. So it really comes down to you need to find a doctor that can really help you pinpoint what is the exact cause of your IBS, and don't be satisfied when somebody says, well, you've got IBS, eat more fiber and just live with it, So it really comes down to proper diagnosis.
Yeah, absolutely, and that's some very great advice about the fermentation and which foods to avoid if it is SIBO. Now, what about lifestyle factors, exercise, stress, sleep, those kind of things? How do lifestyle factors influence IBS and SIBO, and what do you tell your patients about their lifestyle?
That's very integral of really being successful with any kind of digestive treatment. I really believe that, because when we think about what happens when we're stressed, what happens is that your body still thinks that you're running from a tiger, no matter that we don't have tigers to run from anymore. But any perceived stress, what happens is that you shunt blood away from what your body doesn't perceive as important in that moment, which is digestion, and just shunts it to your arms and your legs so that you can properly run away from a tiger. But if we think about if you are constantly stressed, then that's what happens. So you're actually not really getting proper blood flow to your digestive organs, and that's really important and has long-term effects. So it's basically meditation or mindfulness or whatever relaxation techniques you want to use or incorporate into your daily sort of practice would be very, very beneficial to the digestive tract. And I often spend a large amount of time talking to people about that, because even if you have SIBO, you will not really ever improve your digestive symptoms unless you have proper stress reduction techniques. And I see that all the time. And sometimes it's just about taking a walk in nature or deep breathing. I mean, I don't know about you, Carolyn, but I see a lot of people that forgot how to deep breathe. And it's the diaphragm, when you deep breathing, that actually helps to actually improves proper digestion and encourages proper digestion.
It's such a good point.
Like so many times I see somebody that is just like a chest breather and they can't actually even breathe. And so I always say, look, put your hand on your belly and make that hand move in and out with your breath. And if you can't do that, you're the chest breather. And it's that kind of breathing that actually stimulates your rest and digest rather than fight or flight.
I know, and I was a shallow breather, so I know exactly what you're talking about. I had to kind of relearn how to breathe more deeply and I still remind myself about it when I'm under stress. And you bring up such a good point about the tiger, because our bodies were built to run from that tiger, and in the moment our bodies aren't thinking about digestion, and it's that same innate feeling that our bodies get. The last thing that you're thinking about when you're running from a tiger is am I digesting things? So I think that it's such an important thing to know. So what about exercise? What's your advice about exercise?
Oh, exercise is right up there with eating a whole food diet. Exercise can cause your stress hormones to be metabolized faster, so that you don't have that digestive effect. It releases endorphins, and of course it increases blood flow, and if it came in, I always tell my patients, if it came in a pill, everyone would take it, and it's a great. I think that our bodies were absolutely meant to move, and so even if it's just doing some movement, whether that's gardening or something that gets your body not sitting still, and just get up and go for a walk. And finding something that you really love to do. If you hate the gym, then don't do the gym. Find something that you really love to do, and if you love walking, maybe get a dog and start walking. The dogs always get the people moving.
Yeah, it's so true, and Dr. Alschuler and I often say that movement is probably the closest thing to a magic bullet that we have. So we're right on track with you there. And let's talk a tiny bit about sleep, because there's a lot of interesting research connecting lack of sleep with metabolic syndrome, obesity, type 2 diabetes, weakened immune system. Is there a connection between lack of sleep and digestive health?
Well, certainly if your stress hormones are chronically up, as we know, and that's how it relates to also metabolic syndrome, is that you will put weight on around the middle, because your cortisol receptor, or the way you decrease your stress hormone, is basically through fat cells in the abdominal region, and so that's one reason why we gain weight. But also more as it pertains to the digestive tract, for reasons I've mentioned before, it's like if you're constantly sleep deprived, that is a huge stressor to the body. And I often say, I always quiz people about how many hours they sleep and what time they go to sleep, because usually if people are shift workers, for example, that has a huge stress, it causes a huge stress on the body. So often it's the amount of hours, but also going to bed around 10 o'clock, making sure that you're in bed by 10 o'clock, because our circadian rhythms, which is how we are actually sort of in tune with the natural rhythms, is also very important. And we generate deep sleep is very important, and that is only about 2 sleep cycles in the night, and that's where physical repair happens during these really deep sleep times, and that happens mostly between 10 p.m. and 2 a.m. So you really do want to go to bed early, earlier the better, and kind of stay with the normal when it gets dark, and rising when it gets light. So that's the other thing, is I see so many people that are very out of sync with the natural rhythms of the seasons, and also when the sun comes up or when the sun goes down. So it's I think also really important to emphasize.
Yeah, it's such a good point. Rhythm is a big part of the 5 to Thrive plan, so we're right on track with you there. Now, I'd like to talk about dietary supplements, but before I ask you about specifics, what's your general philosophy, and do you feel that dietary supplements can have value in cases of digestive health and IBS and SIBO?
Oh, certainly. I think that I sometimes tell my people, look, I can't just have you basically have your diet changed and hope that everything just works out okay. Sometimes we do need to resort to boosting certain areas of the digestive tract. So, for example, with SIBO, what I do is, besides a very strict dietary protocol, which is about 3 months, but I also have a 6-week protocol where I give natural antimicrobials, such as very high dose activated garlic capsules, and I give gut healers such as L-glutamine, which is this nutrient that helps to rebuild the surface of your intestinal tract, and I give very specific probiotics that are more geared towards stimulating your normal transit time. And so I have a very specific supplemental protocol, but if I think about just general advice, again, it would be more specific to what exactly is going on. So, for example, people that need more digestive power, I sometimes put them on a herbal medicine that combines herbs that are very specific for stimulating your pancreas to secrete more digestive enzymes. It stimulates your stomach to produce more stomach acid, and that's another point actually that we haven't really touched on, is that a lot of people are on medications that can actually promote the growth of bacteria. So, for example, acid blockers and proton pump inhibitors, they can often have actually a huge impact on the overgrowth of bacteria in the small intestine, because our stomach acid is a natural antimicrobial. And I see way too much suppression of this natural process. And a lot of people that complain of reflux actually have a problem with stomach acid. And it's not the overproduction of stomach acid. So that's a whole other area that would also be important to look at. But other supplements, if you just want to start to improve your diet and you still have digestive symptoms, you could just easily try out some digestive enzymes and see if that helps. Those are just really benign products that can help people that really need them. And if you have SIBO, it probably wouldn't make a difference, and so you can try a few things and see if that works. But I really do recommend that people get the advice of a naturopathic doctor or a really qualified practitioner that can help them through this maze of the digestive tract.
Yeah, it's such a good point. And, I think that we're going to have you back on the show to talk about supporting overall basic digestion. And this issue of medications is such an important one, and how, people can be aware of that. And I think that, we could do a total show on that. And right now we only have a couple minutes left, not even. So I want you to tell us, just when it comes to supporting overall digestive health for the average individual who does not have these conditions, what's your recommendation, and is there a supplement that you recommend for just general digestive health?
Yeah, so my basic I don't prescribe to any one diet necessarily, but what we know about healthy eating habits from the Blue Zones, for example, is that Dan Buettner, who wrote the Blue Zones, and he studied people that live the longest, and it's those people that have an 80% plant-based diet, and I think that is a very healthy advice in terms of 80% plant-based could be Mediterranean diet, having meat in smaller amounts, and just a basic good supplement certainly would be probiotics, especially if you've had a lot of antibiotics, and if you think about also, I'm a big fan of vitamin D, and that also has its role in in digestive health. So if I had my maybe top 3 products for the gut, I'd probably say probiotics, digestive enzymes if you need it, and then also I'd probably also go with fish oils or something that helps with decreasing inflammation.
Yeah, that's perfect. Well, there was a lot to cover, but this has been very informative. I want to once again thank you for joining us. We'll definitely have you back on the show on behalf of Dr. Altschuler and myself. Thank you so much for calling in from Australia. And I also want to remind our listeners that you can always get more information about our guests and our books on our website, 5tothriveplan.com. That's all spelled out, 5tothriveplan.com. Follow us on Facebook. Just type in 5 to Thrive and like us, and you'll get all of our updates and notices on Facebook. So enjoy the rest of your evening, and may you experience joy, laughter, and love. It's time to thrive, everyone. Have a great night.